Hi everyone, good morning, afternoon and evening, wherever you are watching from. For those of you who attended our previous webinars, welcome back. And for those of you who are viewing for the first time, welcome. You'll be able to find all of our previous webinars in the series on our Callosum Professional YouTube channel. So you are all on mute. If you have any questions during the presentation, please feel free to add them in the Q&A section at the bottom of your screen. If you do see a question in the Q&A that you'd also like the answer to, then please give it a thumbs up, as this will mean it'll be brought to the top so we can answer it for you. So today we have Dr. Len, whose presentation will be focusing on home care in order to maintain patient results achieved in the clinic. Dr. Len is a board-certified plastic surgeon and specializes in a broad scope of surgical and non-surgical treatments for the face and the body. She has received accolades for her distinctive approach to plastic surgery, where medical skill and an artistic eye meet to give outstanding results. Dr. Len completed 5 years of general surgery training at the renowned Deaconess Health System in St. Louis. She also received specialized plastic surgery training at the Philadelphia College of Osteopathic Medicine, where she held the distinction as chief resident in her plastic surgery class. So without further ado, I'll hand over to you, Dr. Len.
Hi, thanks, Laura, and hello, welcome everyone. I hope everyone and their families are healthy and safe. And I just want to say thank you for letting me share my Callosum experience with you. So please bear with me while I get used to the slides here. We're gonna jump right in. I'll be discussing my current regimen for Callosum use for my patients post-procedurally and post-surgically, as well as maintaining their programs with the home care system, which is essential for the best results. We'll go through the science behind Callosum and what it takes to be a rock star product like Callosum. And we'll talk about the maintenance and the steps to get there. And lastly, we'll do a question and answer period. A little bit about me. I've been practicing now for 19 years. I did my general surgery in St. Louis, as Laura said, and my plastic surgery in Philadelphia. And I am a board certified plastic surgeon since 2006. And I've been using Callosum now for about 2 years and came upon it quite by accident. Simon Webb, who is now currently the US President of Sales for Callosum, stopped by my office on an impromptu cold call on his way to a meeting, and he showed me the science behind the product, and I was really eager to try it. We were actually the first office in Florida to receive Callosum. And once we had the product, I started using it for my patients following laser treatments, as well as after my modified face and neck lifts. And I wanted to see what the wound healing process was like. We saw immediate results, and especially improved patient comfort after laser procedures. And I just saw that the healing process was occurring a lot more quickly. And with the modified face and neck lifts, we actually were able to remove the sutures sooner than usual. So needless to say, I was impressed, and I've been an advocate ever since. And so that probably worked out pretty good for a cold call. So I'll be highlighting the in-clinic protocols, as well as the home maintenance regimen, which is beneficial, like I said before, to get the best results. So what is Callosum? If I can get to the next, there we go. What is Callosum? Callosum is the only skincare powered by cord lining stem cells, and other competing products use other sources that just aren't reliable in protein production. And using stem cells from cord lining, you're able to get a more vigorous response because they're younger and they differentiate better. And the name comes from cord lining conditioned media. And they took the CM, of course, and that's where Callosum comes from. So let's see here. Whoop. There we go. What is cord lining conditioned media? So the media is a balanced mix of all the proteins that are secreted by the cord lining stem cells, and this mix directs the cells in behaving in a more youthful manner, and it helps them, it tells them to heal and rejuvenate as well as differentiate. And it also activates cells to divide, or it instructs the senescent cells to die, which then improves the epidermal turnover. And there are actually over 3,000 different proteins in the condition.
A young person is naturally blessed with higher quantities of youthful stem cells. These stem cells help keep skin healthy by continuously repairing damage caused by aging and the environment. Stem cells do their repair and rejuvenating work by sending youth messages in the form of stem cell proteins to the skin. These messages direct skin to heal, remain firm, and also instruct old skin cells to shed so that new skin cells can rise to the surface. As we age, the number of stem cells in our bodies decreases. They also become less effective in producing cell signaling proteins. As a result of decreased cell signaling activity, skin is slow to heal from environmental damage. It is unable to rebuild its dermal layers, and old skin cells are unable to shed in a timely manner. Skin starts to accumulate pigmentation, loses volume, becomes lax, and starts to look dry and wrinkled. To restore skin to its natural youthful state, it needs a replenishment of essential cell messaging proteins. This allows skin to start acting young and looking young. Umbilical cord lining is a rich source of stem cells that contains high quantities of young stem cells which are ethically and harmlessly harvested. This source of stem cells allows us to derive concentrated stem cell proteins that have powerful anti-aging benefits due to their cell signaling abilities. This rich source of powerful stem cell proteins contain the youth messages necessary for skin to self-repair and actively rejuvenate. Callosum Professional is the only skincare in the world that is powered by umbilical cord lining stem cells.
All right. So the reason I do all of this for my patients is to improve the end results, and as well as having a good outcome, I wanted them to see like an improvement in their skin tone, and it reflects really on the final result, and in the end ultimately reflects on, or ultimately affects patient satisfaction. So knowing that they're using a safe and effective product line like Callosum after their procedure gives me peace of mind, because I know they're not causing any damage to their incision sites or procedural sites with other products. And even though the procedures focus on structure, I want to maintain the condition of the skin and the complexion and its effect on overall results. Also, with the maintenance of their post-procedural results and post-surgical results with this product line, you can also see a nice little increase in product revenue. So my skincare consultation focuses, here we go. So my skincare consultation focuses on 4 areas. Of course, when the patient comes in, you want to ask about their allergies and other issues with current medications, but you also want to find out what skincare products they've used in the past and what they're currently using. And when you have a post-procedural or a post-surgical patient, you want them to follow your recommendations for skincare and not use their own standard program. So I review that at the time of the visit. And we also discuss the goals and where they'd like to take their skincare. And from there, I can expand on the function of the products. Oh. All right, it's not advancing. Let's see, there we go. All right, so I usually recommend addressing 4 separate key areas following the procedure and maintaining afterwards. So if the patient is anything like me, I like it simplified. I don't want 10 different procedures or 10 different protocols to go through after procedures. So It can be broken down into cleansing, treating, moisturizing, and then following ultimately with an SPF. All right. So you can see that we're definitely simplifying the steps by eliminating the need for 9 or 10 different products. Because again, this patient compliance, if they're doing a program of 3 to 4 products, they're more likely to comply and finish their protocol. Let's see here. So hitting the 4 steps, this is what I recommend. I usually start with a cleanser, which is, of course, after a procedure, something that's gentle. We carry our own line of chamomile cleanser, but I also recommend something over the counter. And if they would prefer something over the counter, I would recommend Cetaphil. And this is followed by the multi-action cream, which has the 2nd highest content of proteins in the Callosum line. So this product's going to focus more on issues of a larger scale, like deeper. And this is followed by the Restorative Hydration Cream, and that's fine-tuning the results by hydrating and encouraging the epidermal layer to recycle and renew. And lastly, we always recommend an SPF, and I usually tend to recommend something that's specific for the face because they're more mild and non-comedogenic. SkinCeuticals, for instance, has an excellent facial SPF, but if the patient wants something over the counter, I usually recommend Neutrogena. So here, focusing on the multi-action cream, it can restore facial definition and contours, particularly along a jawline where you see tightening. And it improves elasticity and lifts the skin. And with this treatment, you can actually see thickening of the dermis on cross-section, and that contributes to skin fullness and the appearance of volume. So this patient is 2 weeks after starting the multi-action cream twice a day. And I usually recommend patients place a thin layer around the eyes and extend it to the hairline, kind of helps with the lifting effect. And in this patient, you notice definite improvement in her skin condition, a little elevation of the brow and the improved nasolabial fold. And this next patient is 4 weeks out. Again, twice daily, using the same method. You can see improved skin, improved skin condition. You can see like better facial definition, especially around the jaw, and softened nasolabial folds. Again here, improved skin condition, especially down, around the chin. You can see a little bit of improvement of the jowling along through here. This patient has a little bit of elevation of the eyebrow. Notice here the tear trough is a lot shallower than here. The nasojugal junction is a lot shallower. The cheeks actually look a little bit tighter, a little bit smaller, and the jawline is just a little bit tighter. Here you can see eyebrows and eyelids are elevated. The cheeks appear a little higher, a little bit more fullness under the eye. And especially right here, you can see this little area right here along the jowl is also much better. So this is really significant. This is after 6 weeks of using the multi-action cream. You can see significant decrease in the rhytids. This picture here, you can see it even a little bit closer. So definite reduction in the appearance of lines. Here again, we note around the crow's feet, alongside the mouth, a little bit of improvement there after 6 weeks. Here you can see it even a little bit more defined, as well as the forehead. Here you can see after 12 weeks, improvement in the brightness of the skin, a little less erythema. The skin looks a little bit more even over here after the callosum. And then here you see a reduction definitely in the erythema. Okay, so the next product is in the maintenance line is the Restorative Hydration Cream. And this treats more, like I said, it fine-tunes, so it treats the fine lines and hydrates the epidermal layer, and it creates the hydration necessary for cell turnover and repair. This shows, skipped by one. This shows the results after use, 2 weeks and 4 weeks with the hydration cream. You can see the definite evolution here, especially in this area. The patient looks less tired, a little bit less shallow area here, and a little bit of lifting through the jowl region and improved nasolabial folds. Here again, nasal jugal junction, you see a little bit more fullness and improvement around the mouth with a decrease in the minor shadows and fine lines. That's a side view. Okay, Callosum, the Callosum Professional Serum is the one that I use following my laser procedures and following my modified face and neck lifts. And with the post-procedural laser or microneedling or the surgery, you're going to see a significant reduction in redness and swelling. And more importantly, I guess most importantly, it improves patient discomfort following the procedure. And it speeds the healing and contributes to the overall aesthetic result. And as I had said before, it, you know, we noticed with the post-procedural and post-surgical patients that we were able to remove their sutures a little bit faster because of the increase in the healing time, or improvement in healing time, I should say. All right, here you see, this is after CO2 laser. This side had the Callosum applied after the laser. This side did not. You can see definite erythema here as expected from the laser. So you do get recovery from the swelling and the redness, but you still get the same effectiveness of your CO2 laser treatment. There we go. And here's a side view. This, of course, is the side that was treated, and this side is still erythematous. This is an excellent pre and post. You can see after microneedling with the professional serum, she definitely doesn't appear as sallow here. Improved skin tone, the lines are softened, you don't see as much sun damage, and the skin is plumper and tighter for sure. This is treatment of acne scarring. This is microneedling with the Callosum applied, 3 treatments, 6 weeks apart, and you can see definite improvement in the scarring. Here, this is non-surgical blepharoplasty, and the serum was applied. You'll see this side was the one. This side is the one after the application of the Callosum. You see reduced erythema, reduced edema, and improved result. And this is what I've noticed specifically with my post-surgical patients is this exudate. So in a modified face and neck lift, or any surgery for that matter, if you get the exudate and blood mix, you know, along the incision line, it can actually split the incision and make it, you know, leave a widened scar. So what I found is the Callosum use in my post-surgical patients significantly reduces this exudate and crusting, which makes it heal just so much better. There we go. This is treatment with RF for stretch marks. And this picture is probably the best way to see it. This is the before and the after using the Callosum. And you can see quite a bit of difference, more from this to the callosum side than you can from the before and non-treated side. And this is hair restoration. And this is microneedling with callosum applied, and the change is obvious here. This was taken at week 12. So this slide is kind of a summary of the products, and you'll see over here, this is actually the Recovery Night Complex, which we didn't really touch on, but it provides a reduction in post-procedural irritation also, and it accelerates recovery. This is a gel that's worn through the night, and as you can imagine, it relieves some of the dryness and itchiness and overall discomfort after laser resurfacing or microneedling. And it can also be used in the maintenance program to heal traumatized and distressed skin, especially if someone's using something like a retinoid too aggressively. So it actually helps to hydrate the skin also. So these are the three that I use most often. The professional serum. This actually has 80% concentration of proteins, and you know, so you can imagine the excellent healing that you can get from using this product post-procedurally or post-surgically. A multi-action cream is the next with 50%, and the restorative hydrating cream is more of the moisturizer and provides the hydration, and it's at 40%. All right, and the thing that I hear the most is my skin looks fresher. And you know, when you're doing this protocol and this maintenance program after a procedure, it just ultimately ends up in better patient satisfaction. So we'll open it up for any questions.
Thanks so much, Dr. Len. So yeah, we'll move on to the Q&A. So if you do have a question, please feel free to put it in the Q&A box at the bottom. There's also a raise hand button at the bottom of your screen. So if you do want to ask your question directly to Dr. Len, then you can click that and you'll be prompted to unmute your microphone. So we'll start with the Q&A box. We have one question here that says, you mentioned about post-surgical care. What is your protocol?
Oh, so when a patient is, when I do a modified face and neck, of course, I almost always start with the left side. After I put in the sutures, my assistant immediately puts 2 drops along the incision line. And then I move to the right side, and then we repeat that protocol. And then we do it again before they, oh, are we okay there? Yeah. And we do it again before they leave. And then the patients are instructed to place 1 drop pre-auricularly and 1 drop post-auricularly after surgery for up to 2 weeks, 2 to 3 times a day. Now, initially, we used to put steri strips over that, and we noticed that things were getting a little too moist. So now I don't put any steri strips. I don't cover the incisions, and they are able to put the callosum on there, and we've noticed, you know, just impressive results.
Okay, amazing. So we'll just wait for a couple more questions to come through. And we will go live to the floor. So if anyone does have a question, feel free to click the raise hand button. Okay, so we've got a question here asking if you could go back on your hair protocol.
Yeah, it's after the microneedling, we usually apply it immediately. I ask the patients to do it again 2 to 3 times a day following their procedure, and again they continue that for about 2 weeks. So pretty much identical to the post-procedural or post-surgical recommendations.
Okay. We've got another question here asking if the products can be used on patients with mild to moderate acne.
They can be used for mild to moderate acne. You know, the Callosum products don't have a drug classification. So you're going to see some cell turnover. So again, that's going to improve the results. Most likely you would want to combine it with some other type of protocol, or maybe even some drug regimen.
Mm-hmm. Okay. Have you seen any side effects from the use of Callosum serum? And if so, how did you overcome it?
I have not. I have not seen any problems with it. Like I said before, in my post-surgical, if we use steri strips, and they were to apply it directly over the steri strips, we did notice that it was just a little bit too moist, and they ended up with just a little bit of maceration. But other than that, that's the only reaction I've ever, that's not even really a reaction, but that's really the only issue that I've seen.
Okay. So we've got another question here. Could you tell us more about the wound healing effect on plastic surgery procedures? How much more quickly can the sutures be removed?
Right. So, typically I would always remove the sutures at 7 days pre-auricularly and 10 days post-auricularly. And what we're seeing is the sutures, the pre-auricular incision line is so well healed that when they come in at 7 days, it's almost as if they're starting to absorb the sutures. And I use a nylon suture, and it's much easier to remove. And the post-auriculars are coming out now at 7 days. So I can remove both the pre-auricular and the post-auricular at the same time.
Okay. Does the serum help to reduce or prevent skin PIH?
That may be a better question for you, Laura. I'm not sure. I've not really used it in that sense.
Yeah, we have found it's reduced it quite effectively, which is great.
I imagine with the cell turnover, and the skin renewal, and the sending it in the direction of the senescent cells dying, and and creating that process all over again, I think that it would probably be very effective.
So when you do scalp microneedling, what is the needle depth that you use with Callosum?
Just the general protocol. We don't have any special needle depth for different protocols. We use the same with PRP, so it's exactly the same.
Okay. Someone's asking, so the products can be used for patients as young as how old would you say? What would you typically recommend?
How old? Anyone over the age of 18, I believe. That's usually what's recommended, right, yeah. Laura? Anything over 18. And, I don't think there's any age limit that you can use, the product with.
Okay. Can the serum be used synergistically with platelet-rich plasma?
I've not tried that. I've been tempted to try that. I think that it would most likely be effective. You have to have some type of, especially for the professional serum, if you've got a concentration of 80%, you're going to have some type of delivery system for that to go through the skin barrier. And with that, you want something that has liposomes. So, you usually add like a moisturizer, but I'd be very interested to finding out if anybody else has had any experience with that.
Mm-hmm. Okay. So we were saying that patients, obviously we recommend using the products for those who are 18 plus. Someone's asking about young burn patients, so more kind of off-label use.
Yeah, I have used this in my wound care patients. I've used it in chronic ulcers, and we have noticed improved healing. I had a patient who had a small chronic venous ulcer and probably had it, I think, for about 2 years. And with the use of Callosum, we were able to get it closed in like 2 months. So I have definitely seen improvement. I've had patients who have used it for burns. I've used it for my burns, and I'm very impressed with the results.
Okay, amazing. Can we use the serum to treat mild irritation of eyelids secondary to hypersensitivity?
Maybe you can help me out here, Laura, but I don't think it would be indicated for use on the eyelids. It does, it will drip down. What is your experience? I've not used it for that. Do you have any
I think with the
recommendations?
eyelids, slightly more careful.
Yeah.
But yeah, with hypersensitivity is,
Mm-hmm.
Okay. So for post-procedure, so post-surgical care, how much of the serum do you actually use?
Yeah, the serum comes in a 6-pack, and it's all dependent upon the patient. We apply it here in the office, and we literally just use overall as a total 2 drops pre-auricularly and 2 drops post-auricularly. I've had patients that, you instruct them to give it to use it 2 to 3 times a day, and they end up putting it on every 15 minutes. So they go through their 6-pack pretty quickly. But typically they'll probably go through 3 of the vials in that 2-week period. And then following that, I ask them to keep it. They can use it for continued maintenance with their program. So again, they would use the serum followed by the MAC and the restorative hydration cream.
Mm-hmm. And that kind of links on to another question, which is asking if sort of you recommend, all your patients to then move on to the home care.
Yes, absolutely. They get sent home with the home care. We give them, both of those 2 products. We've actually started using the recovery night also too, especially post-procedural. That is the best product. I know I've had CO2 laser, and that first 24 hours, that first evening after your procedure, it's a little, it's a little itchy, a little dry, and the night recovery has really helped with those symptoms.
So is the product affordable for most patients, you found in your experience?
Yes, yeah, especially, from the plastic surgery sense, patients who come in and are having cosmetic procedures like a modified face and neck or full face and neck, or, they're willing to spend just a little bit extra for the product. So I find that my patients, they don't think twice about it when it comes to giving them the best result.
Okay. Do you have many different ethnicities as patients, and have you noticed any difference in effect or not?
I do have all ethnic groups, and I haven't really noticed any difference between them whatsoever.
Okay. So let's have a look. Does the Recovery Night Complex have the condition media in it? The calcium, it does.
Yes, it does.
Yeah. Also about 40%.
40%, yeah.
So can we apply Callosum serum or cream on the upper and lower eyelids?
Lower eyelids, yes. Again, with the cream, once it hits the body temperature, once it hits a warmer base, it might run. If they were going to use it in the upper lids, I would ask them to use it very sparingly. Mm-hmm. Lower lids, no issues, and they should be able to use it easily.
Yeah. So for post-procedure, how long do patients have to apply the serum for?
Approximately 2 weeks. Ultimately, at 14 days, all of their sutures, have already been removed. So we just continue for a few more days after that, and that's all they really do, unless they have extra and they want to continue to use it in their home maintenance program.
And is that with non-surgical procedures as well?
Yes, non-surgical as well.
2 weeks, okay. So we will still go live to the floor, so if anyone does have any questions, just click the raise hand button at the bottom of your screen and have a look. And if not, that's all of the questions, I think. Okay, amazing. Well, thank you so much, Dr. Len, for presenting.
Absolutely,
today.
my pleasure.
And thank you everyone for tuning in and watching. If you have any other questions, please email customerservice@callosum.com. Hopefully we answered quite a few here, but do let us know if you have any others. And there will be a feedback form as always at the end, so please let us know what you thought.